Alright, so now we're going to move into our experiential exercise, and it's a two-part exercise. Part one is going to be a lot of me demonstrating for you guys the drug testing protocol that we've been talking a little bit about. So, the goal of this exercise is really to give you guys an opportunity to understand the drug testing protocols that you will then be teaching families how to do. For many of you, this is really going to be a new intervention, so hopefully you guys will get a lot out of this. Again, these are the protocols that you're going to be teaching the families, so we want to make sure that you guys are pretty versed in how to introduce and implement drug testing with your MST families. So the first thing I'm going to ask you guys to do is briefly review handout number 5 in your handouts. It is titled Frequently Asked Questions About Drug Testing in MST. This is a really great tool that you guys can use with your families, with the caregivers, as you're introducing drug testing to them. It's a lot of information. It's really valuable information. You guys will become much more familiar with it as you, over time, as you use it and review it with families. But it's a great tool because it talks about a lot of different aspects of drug testing. It talks about some information about the in-home kits. It talks about how long substances stay within the system. It talks about some things that kids might do to try to beat the test. So it's a lot of good information, and again, frequently asked questions that parents have. So it's could be really helpful for you guys to take this out to your families and use with them as you're introducing these drug testing protocols to them. Any questions about that? Great. All right. So the next thing that I want to introduce you guys to is handout number 6, which is titled Caregiver Handout for Conducting Drug Screens. Again, these are the steps that you are going to teach caregivers to do, but you also need to make sure that you're aware of them, because these are the exact same steps you're going to follow as you're demonstrating how to do the drug screens with the families. So, what I would like to do is go through these with you guys today. And really, step by step, really show you guys how you're going to be doing these drug screens and alcohol breath scans as well with your families as you're teaching them the caregivers how to do the drug screens. All right, so let's start with again back on handout number 6. Before collecting the sample. So, what you want to do is help parents understand that they're going to need to take everything out of the bathroom that the youth could potentially use to change the urine specimen. So, any cleaning solutions, any containers with any type of liquid in it, medications, etc. You may also want to take a box out with you to the session. Just in case the family doesn't have one, you can provide it for the caregiver because they may want to, have something to put all of their, cleaning solutions, medications, what have you, into as they're removing them from the bathroom. So just going prepared in case the family doesn't have a box. The next thing that you're going to want to do is make sure that you either bring out some tape or the family has tape to be able to tape the water faucets using masking tape or something similar so that the water can't be turned on without breaking the tape. So you want to make sure that there's a barrier over the faucet. Again, the youth may try to use that to dilute the urine specimen. Then what you want to do is take the cup. So this is the urine test. You're going to want to write the youth's name and the date on it. And there's a place right on there, and I'll be passing this around in a minute to show you guys, what the test looks like. So then once you have that done, you will then tell the family, well, actually, pause, go back a second. The family, the caregiver, will write the name and the date on the cup, not you. You're teaching the family how to do that. Then you're going to talk to the parent about how they're going to ask the youth to remove any baggy clothing and jackets that they may be wearing. This is something that you might want to role play as well with the family around how they're going to ask the youth to remove their jackets and baggy clothing, and really setting that limit with them, preparing them for any potential conflict as well. Then, whatever, if the youth has left their pants, or if they have any, like a light jacket that might have pockets, you still want to talk to the parent about the need to search them in case they are still trying to hide something that they might use to dilute the specimen. Alright, so then what you're going to want to do is talk to the parent about also having some disposable gloves. And of course we want to use that so that the parent can be protected from the urine specimen. They don't want to get it on their hands, just like we don't want to. Alright, so then the other thing that you're going to want to do is make sure that the family has some sort of device, whether it's a watch, or if they have a smartphone that has a timer, or some kind of kitchen timer or egg timer, that they can set to 5 minutes. Because that's what we're going to want to use to monitor the test. Once we have the urine specimen, we're going to need to have that 5-minute countdown so that we know when we can start to read the results. Any questions on that so far? Alright, again, just to reiterate, these are all the steps that we want to make sure that the family is really feeling confident in using, because this is what we're going to use to help them to reduce any potential conflict that might occur when the parent is asking for the urine specimen. Alright, so once we have the bathroom all ready, we have the youth ready to give us our specimen, what we're going to do is give the youth a cup. We're going to have them go into the bathroom and pee in the cup. We want to have, of course, some appropriate supervision. So talking to the parent about standing maybe with the door cracked open slightly with their back facing the crack so they could still listen in case the youth does try to do anything, if they hear any shuffling around in there, that they might be trying to, again, dilute the test or beat the test in some way. So once the youth comes out of the bathroom, they're gonna, what we want them to do is make sure that they have closed the cap tightly on the top before they hand it to you. And then what you're going to do is put it on a flat surface, just like so, and make sure that that top is down nice and tight. At that point, what you want to do is, again, and this is, the parent is doing all of this, what you want to have the parent take a look at the temperature on that cup while it's down, and that temperature strip right here, it should be between 90 and 100 degrees. If it does not read that temperature, then you want to consider the test invalid, and you would either give them another test, ask them to do it again, or you would consider it a dirty screen. So then, what you want to do is place the test so that you can see the flat side. You want to remove the label just like so. And what that's going to do is going to reveal the 3 panels with a C at the top and a T at the bottom. And we're going to talk about what that means in a second. At that point, what you want to do is insert this little round wheel. It's the key that comes with the drug test, and keeping it nice and flat, what you'll see is, again, there's a little circle here, and that's where you're going to insert the key. So you're going to, keeping the test flat, insert that key in until you hear the pop. Once you hear that pop and you've inserted that key, that is when you want to start your timer. So you start your 5-minute timer right then and there. And then you just let it sit and you wait 5 minutes to get your results. So I'm going to pass that around so you guys can take a look at the panel on the front. really take a look at the temperature strip and how to pop that key in right here. So I'll pass that around. And while I pass that around, we're going to talk about how you interpret the results. So again, like I said, you have the C for each, there's the 3 panels. It's going to test for cocaine, amphetamines, and marijuana, which is the THC. And what you're, again, we have a C at the top and a T at the bottom. So what you're going to see is if there's 2 lines that come up, that means that the test is negative for any of the 3 drugs that we're testing for. If you see 1 line and that's appearing at the top by the C, that means that the youth is positive for that particular substance. If you see no lines or only 1 line at the bottom by the T, that means that the test is invalid, that something went wrong during the test and we should do another test. So again, if you have 2 lines, that means that the test was negative. If you have 1 line at the top by the C, that means that the test is positive for whichever one of the substances you see the line by. And if there's 1 line or no lines, or 1 line by the T or no lines, that means that the test is invalid and you probably will need to repeat it. A couple of additional things that you guys want to think about when you look at the test. Again, 2 lines means negative. Even if the line is super faded, if there's a line there, it means that it's negative. We would count it as a negative screen. So just so you guys are aware of that, some parents might get a little bit nervous because the line is faint. They think it might mean that there might be something in their system, but that would definitely be still considered a negative screen. So then, you know, what you might want to have the parents do at that point, you know, just for verification, is maybe take a picture. If they have a smartphone or a camera phone or something, that they could take a picture to show you for verification. The other thing that you might want to have the family do is open back up the top, dump the urine out, making sure they still keep their disposable gloves on, and then maybe putting it inside of a plastic bag or something. Maybe that would be, if they don't have a way to take a picture of the outcome, that could be another way just to sort of save the test in the plastic bag so that you guys would then be able to, as a therapist, see the results as well. Everything else gets disposed in the trash, helping them, you know, throw the gloves out, the tape out. You know, they could return all the stuff to the bathroom until the next time they're going to take the test if they would like to do that. So in your handouts, one of the other things that you guys have is the actual instructions that we just went through about how to give the drug test. Is kind of also in picture form as well. So this is also something that you guys could give to parents. Again, if you're using this exact drug test, you know, if your agencies use a different type of drug test, make sure that you are well versed in how to instruct the family on how to give that drug test, and that you have also a written set of instructions to give the family as well. Any questions on how to conduct the urine screen? All right. Now, we're going to go over how to conduct the alcohol breath specimen. All right, so again, just like I said about the urine screen, these particular instructions are for this particular breath scan. If your agency is using something different, please make sure that you're familiar with the instructions for that breath scan, because it may not be the same. As you'll see in a minute as we go through, there's some real specific things that you're going to want to make sure that you're doing to make sure that this is a valid test. So, how do we collect the alcohol breath specimen? The first thing that you want to do is make sure that your tube is not bent or crushed in any way, so that it looks really good. Then you're going to squeeze with your thumb and your forefinger in the middle to break that plastic little glass piece that you'll see in there. So I'm going to actually do that right now. We're going to demonstrate how to do that. Making sure that you don't break the outer plastic. Then you need to use the test immediately. So there's a little bit of there's an arrow, and that's where you're going to have the youth blow in. And what you're going to want them to do is take a deep breath and exhale for 12 continuous seconds, making sure that they don't inhale. So I'm going to do that right now. All right, so then what you're going to see is if it's negative, and hopefully it is because I have not had any alcohol today, you're not going to have a color change. It's just going to remain the same. And what I'm going to do is I'll pass around a not used one and the one that I just used. And you'll see there's no color change. That's actually the best way to get a result on this test is kind of have that comparison, because if it's positive, what you're going to see is the little crystals that are inside are going to change to like a bluish green kind of aqua or teal color. So I'll pass that around. You guys can take a look at that. Any questions on how to use the test? The other thing I think I forgot to say is just shake it around a little bit after to make sure that everything is distributed, the crystals are distributed equally. And you have to wait 2 minutes. I forgot a couple of things actually. So let's briefly go over that again. So break the tube, just the inner tube, not the outer tube. Arrow section, blow into it, inhale, then have these blow for 12 continuous seconds, not inhaling. Shake it up a little bit, wait 2 minutes before you interpret your results. Again, if it's negative, there will be no color change. They'll remain that yellow color. If it's positive, they'll turn into a greenish blue sort of aqua color. Now, are there any questions? I'm sorry, I forgot those couple of very important steps. All right, great. So I'm going to move us along as long as there's no questions. Just before I move on, just a couple, again, I guess I can't enforce this enough. The tests are pretty user-friendly, but you're going to need, some time with the materials. Make sure that, you're pretty proficient in them, reviewed the instructions a couple of times before you're going to feel pretty comfortable introducing them to the families, and expect the same for the families. Like the caregivers are definitely going to need some practices in terms of giving the drug test based on the instructions. So you may want to go through it with them a couple of times, making sure that, we want them to feel confident and comfortable giving these tests, because the more confident they feel, the less likely there is that there's going to be conflict, and the increased chance that they'll have success with these interventions. So in order to help us, to help the families feel more confident and comfortable, one of the tools that we have is handout number 9, and that is titled Introducing the Drug Testing Protocol Therapist Checklist. So what this checklist is really designed to do is first of all, it's adapted from our contingency management manual, and it's a guide that can help to ensure that the therapists, so you guys, have covered all the key points that the family needs to know related to conducting drug screens. So if this is completed point by point and combined with walking through the caregiver handout for conducting drug screens, it's really going to increase the likelihood that the caregivers are going to follow through with drug testing the youth. For example, the caregiver might be worried that drug testing is going to increase that conflict, like we've talked about a couple of times already today. So then the therapist can really bring them back to all these tools and assuring them that the procedures that they're going to teach them, along with following the behavior plans that have already been developed, and learning how to do all these drug testing procedures, are really going to help to decrease that conflict. So again, kind of bringing all the pieces together to really show them that by doing all these things in combination with each other is going to really help to decrease the conflict. If in fact you do run into some additional potential barriers or questions that the family has, what we have in handout 10, it's about 3 pages long, is a troubleshooting kind of little guide here. So it's titled Troubleshooting Tips Drug Testing Protocol. And what it does is it lists out a couple of different challenges that might come up when you're giving drug tests to youth. So challenges that the family is going to encounter or might encounter, and then some possible solutions. So for example, number 3, which I talked about a little bit earlier, avoid arguing with the youth. The youth refuses to provide the breath screen or the drug screen or the breath scan. So we want to help the solution would be that we would teach the parent to avoid arguing with the youth about it, but remind them of the consequence. Again, you already have that behavior plan established, so just reminding them of the consequence of having of not providing the specimen. You would have already specified in that behavior plan that not providing the specimen is going to count as a dirty drug screen. And then if they still choose not to provide it, helping the parents see that it's just the solution is following through with the consequence, or maybe setting some kind of a time limit on it. So okay, well if you're saying you can't go, you have 30 minutes, maybe drink some water, and then we'll try again. If you still can't go, or you're refusing to go at that point, we're going to consider it a dirty screen, and the consequence will be whatever is already laid out in the behavior plan. So there's a bunch of different ones. A bunch of different possible barriers. Again, great tool to use, great tool to give to the family. I think they will find it very valuable because it's all things that a lot of families already are predicting, and we have some solutions here for you guys to work on with them. Any questions about that? All right, great. So that means that we get to take a break.